So now we're going to be moving on to the cranial nerve assessment. So the first is your olfactory. So maybe close your eyes for me. Close one of your nostrils and tell me what the smell is.
Cinnamon.
Right. We'll do the same for the other side.
Garlic.
So cranial nerve number 1, olfactory, is intact. Now we're going to assess your optic. I'm going to be open your eyes for me. Just follow my finger to your nose. Okay. So cranial nerve number 2, olfactory, is intact. Next, we're going to test for cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens. So I'm going to have you just follow my finger with your eyes. Okay. Okay, and I'm going to have you hold the lateral gaze this way. Look for nystagmus. No nystagmus present. All ocular movements are intact. Now I'm just going to check one more thing. Tell me when you can see my fingers.
Now. 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 Now.
Okay, cranial nerves 3, 4, and 6 for eye movements are all intact. Now I'm just going to go ahead and hold up this card and look at both eyes separately. Okay. So that was my final test for those cranial nerves. They're all intact. Now we're going to do for your trigeminal cranial nerve, which is cranial nerve number 5. So have you clench for me. Okay. The muscles were equal bilaterally there and intact. Next, I'm gonna go ahead and have you close your eyes and tell me when you feel me touch.
No. Now. Now. Now.
Okay. And then now just tell me if you feel sharp or dull. This is dull. This is sharp.
Sharp. Sharp. Sharp. Sharp. Sharp.
What is this?
Dull. Dull. Sharp.
Right.
I'm sorry.
It's okay. So your cranial nerve number 5, your trigeminal, is intact. Now I'm gonna move on to cranial nerve number 7, which is your facial. So I'm gonna have you smile for me, and then frown, make a surprise face. So your cranial nerve number 7 is intact. Next, we're gonna do cranial nerve number 8. We're gonna perform the Weber and the Riney test. So I'm gonna have you close your eyes for me. I'm gonna use my tuning fork here. I'm gonna put this in the middle of your skull and tell me if you can hear it in both ears and when it starts and when it stops. Can you hear it?
Yes.
Both ears?
Yes. It stopped.
Okay, perfect. Now I'm gonna do the same thing on both your bilateral ears here. So tell me when you hear it start.
It started.
Tell me when you hear it stop.
It stopped.
Tell me when this stops.
It stopped.
Okay. I'm gonna do the same thing on the other side.
It stopped. It stopped.
Okay, so the auditory cranial nerve is also intact, and the bone conduction was half as long as the air conduction, which is normal. Now we're going to move on to cranial nerves 9 and 10, which is your glossopharyngeal and your vagus nerve. So I'm going to have you open your mouth for me. Say ah.
Ah.
I'm going to test your gag. Okay, sorry about that. The gag's intact. And then I'm going to have you take a drink of water for me for your swallow. Okay, cranial nerves 9 and 10, your glossopharyngeal and your vagus nerve are intact. Next, I'm going to test for cranial nerve number 11, which is your spinal accessory nerves. So I'm going to have you raise your shoulders for me, okay? And then move your head towards my hand, on the other side, forward, back, okay? So the spinal accessory nerves are intact, strength's 5 out of 5 there. Now we're going to move on to cranial nerve number 12, which is your hypoglossal. So I'm going to have you stick your tongue out for me, move it up, and then down, and then I'm going to have you move it from side to side, and then press against your cheek over here and over here. Strength's a 5 out of 5. Tongue appeared to be midline, symmetric, and all movements in all directions were present. And I believe that is it for our cranial nerve assessment. Thank you.